Good day, everyone, and welcome to the StayWell, Educate, Engage, and Support Your Members with Award-Winning Content conference call. Today's conference is being recorded. At this time, I'd like to turn the call over to Victoria Picazo. Please go ahead, ma'am.
Thank you, everyone, for joining us today. My name is Victoria Picazo, Vice President of Payer Solutions with StayWell, and I am here today with Patricia Heil, Vice President of Clinical Product Management, and Mark Tatara, Associate Creative Director. Combined, we have over 50 years of healthcare industry experience, from operations and sales to product management and member marketing. We are passionate about helping you reach your engagement goals by delivering an exceptional experience to your members. We are very excited to be here today to share how we can help you help your members live healthier, happier lives. And also wanted to share with you, we will be answering chat questions at the end. So please submit any questions by clicking the chat icon on the lower left corner. If we run out of time to answer your questions, we will follow up with you after the webinar. About 15% of people in the population are in a patient state at any given time. The other 85% of the population are in consumer mode, where other influences besides clinical data are the drivers of overall health status. Are you reaching those 85%? We want to help you strengthen your relationship with your community to help you engage, acquire, retain members with StayWell's help. I won't bore everybody by reading all of the stats here. In fact, I have more that I want to share with you. Like 80% of internet users seek online health information. 77% of patients used a search prior to booking an appointment. And 66% of internet users look online for information about a specific disease or medical problem. Here, the numbers really tell the story. And here's where StayWell fits into that story. Whether the goal is to drive web traffic, improve member health, or increase brand preference in the communities you serve, StayWell can help. Leverage our comprehensive suite of digital and print-based marketing tools to support your brand and strategic marketing goals with credible, actionable health content that commands attention and drives positive responses. There's the 1-2 punch, print and digital. Our solutions can help provide benefits to your members as well as value to your organization. We help you empower your members with the information they are obviously seeking, reduce healthcare costs by providing education regarding general wellness, preventative care, and disease management skills, all while we help your organization build brand awareness and cultivate that loyalty with credible and engaging health content, content that grabs people's attention. I will now turn it over to Mark, who will show you ways we engage members through our print solutions.
Thank you, Victoria. Strategic engagement through content and design is what we do. Think of StayWell as your marketing agency that can help with all media. Here we'll take a look at print, the once presumed dead medium that's had a comeback. As a part of any marketing mix, we strongly recommend print. In a recent survey, 92% of college students said they preferred reading print material to digital. Digital natives apparently appreciate a break from the screen. And beyond that, emerging demographic, more than half of patients in the general population rank print brochures or booklets as the most useful communication method. Across all media, good content is the gift of information to your readers that builds a strong relationship. Our custom print marketing solutions give you access to thousands of articles, images, infographics, and more. We can help you choose the right mix to develop marketing solutions that promote your brand and organization. Our ever-expanding content collection can be used as is, or it can be customized as much or as little as you like. We can also guide you on best practices. Magazines, for instance, are expected by readers to be about them. This allows for content to really step forward and expand the reach of your brand with new graphic devices that add a dynamic, contemporary feel that readers respond to. StayWell offers you more than 40 years of health communications expertise, and we consider ourselves an extension of your team. We're ready to collaborate with you to develop a strategic publication that meets your goals and one that is of the highest quality. We pride ourselves on awards. The example in the middle of this slide won a Best in Show in the Healthcare Advertising Awards. Our editorial staff can help you choose and craft the perfect message. Our design staff can help create layouts that catch the eye and convey and elevate your brand. Our account managers ensure operations, collaboration, and communications run smoothly, and our seasoned production staff guide your publication from concept to print to shipment. We are 100% fluid. Our team can fill any gap that you have organizationally, and we can even identify ones you may not know you have. Our goal is to make your work better and your work lives easier. Regarding customization, it's your call, as little or as much as you like. Here's just a few examples of what we offer. Calendars can help you target specific audiences in a highly visible way throughout the year, from general health to men's health, pregnancy, heart health, any segment that's important to your business. Also, our calendar product offers extended features such as appointment reminder stickers, recipe cards, inserts, and more that can all be tailored to any specific audience. Custom member publications help you deliver key messages and drive action. Custom print education provides award-winning clinical information for use in mailing, health and wellness fairs, you name it. Custom recipe booklets have real staying power and are a valued gift. Use recipes from our template or include ones from staff or members. You can also include regional or cultural recipes to appeal to your audience as well. And of course, push online for a deeper engagement. I'll pass it off to Patricia, who will speak more about engaging members online.
Thanks, Mark. So now I'm happy to give you an overview of our updated StayWell Consumer Health Library, a rich tool that enables you to create an engaging online destination. StayWell's Consumer Health Library, that we also refer to informally as the SCHL, is designed to engage and educate your members and enable you to continue to build relationships with them by providing your members with the health education they need. The Health Library can assist with your strategic business goals of building brand awareness, credibility, and promoting the services and programs that you provide to your member population. The Health Library includes a suite of digital solutions encompassing disease, condition, and treatment information, as well as wellness resources. We provide tools that are engaging and informative. These interactive tools include quizzes, risk assessments, and calculators around a range of both condition and wellness topics. In addition, there is a comprehensive medication information, drug search, and drug interaction checking tool. The foundation of the Health Library is our award-winning StayWell Health Education. StayWell content is written and reviewed by leading medical and health experts using the latest medical guidelines and evidence. Our sources include peer-reviewed research and public health sources. The StayWell Health writers translate the sophisticated medical content into a resource that people can understand and use in their daily lives. We do this by applying a rigorous plain language methodology to every piece of content. We want people to understand their condition and be empowered to use the information to reach their best possible health. We continually update our health education, responding whenever the medical evidence changes. In addition, we want to ensure that your members have access to fresh information, and we add, on average, about 40 new articles each month. We do this through our editorial process of daily monitoring of health news, medical texts, journals, and recommendations from government institutions and academies. This process informs new topics and content updates. We also want to meet people where they are in their information search. We know that over half of all searches for health-related information comes from smartphones and mobile devices. We have designed the SCHL to be responsive and mobile-ready. With the new design, we have also enhanced our search engine optimization so that when your member is looking for health information, your site is in the top search results. With the SCHL, you can provide a trusted and reliable health information resource for your members. When they come to your site, your brand is front and center. The SCHL can be fully branded and customized. Your SCHL site is branded with your logo, style, and colors, making a seamless experience for your members. In addition, you can include your custom content and quotes from your experts. Our content can be shared via social media and used in your social media strategy. Your SCHL also contains links to your social media sites to drive engagement with your brand. As you will see later in this presentation, you can also include links to your programs and staff to fully connect your members with the resources that build their relationship with you. The new SCHL has a modern, clean interface and design, providing your members with a dynamic site that they can continue to come back to. We have many types of content to engage members while they are learning. Our resources are provided in multiple formats and styles to meet different learning styles and needs. So here are some of the detailed features that we're offering. The Health Library answers the health questions that your members are asking. We have a rotating set of daily quizzes, calculators, and assessments to increase engagement and respond to health issues that are in the news or of a seasonal concern. Videos, animations, and podcasts provide many types of learning experiences, helping people learn by reading, listening, watching, and doing. Our interactive symptom checker lets members explore their symptoms and gives them actionable next steps for seeking care or taking care of themselves at home. All of this is designed to be easily accessed and usable. We have incorporated a Google search appliance to provide fast, intelligent search results, and we provide a language translation service that converts content into 66 different languages to meet the needs of your diverse member population. And of course, a picture is worth 1,000 words. At StayWell, our content is designed to be relevant, valuable, and engaging to your audience. And with the increasing demand for health and wellness content, our top performing clients are ensuring it's broadly distributed to your members. Video is just one example. We have a number of video libraries that come with the SCHL. The video libraries are filled with short, shareable, and timely video segments that help consumers make better choices for their health with tips and tricks for better fitness and nutrition, public health advice, and more. These include our condition and wellness videos that help members learn a new skill and take action on their health. We provide our patient and caregiver videos that connect viewers with the experience of others who have a similar condition, treatment, or health concern. You can also add on to the video library. We are rounding out our library with specialized resources such as the 3D animation videos that are developed by our video partner, ViewMedica. These videos take your members into a detailed presentation of their anatomy or a procedure they may be considering. There are so many options with the SCHL. I just want to highlight a few of the value-added tools that you can use to further customize your SCHL site. The first of these are the health evaluators. Health evaluators leverage consumers' curiosities about themselves and their health risks. They are short questionnaires that walk people through an assessment of one of 5 important health issues. Health evaluators help people identify if they are at risk for heart disease, diabetes, or stroke. They also help assess the possible impact of weight and osteoarthritis. At the end of the assessment, a user is provided with an overview of their risk and education about how they can reduce their risk. The user can also register their contact information to receive more information from you about the programs and services that you offer. These are likely programs that you already have in place. The health evaluators provide you with a lead to an engaged and activated member who is ready for more assistance. To help you reach more people through the health evaluators, StayWell offers a marketing toolkit with ideas on suggested media, target audience, and strategies. We are here to help you develop and execute outreach to your members and prospective members. Next, I want to talk to you about our partnership with Wiser Together. Through this partnership, your SCHL site can include the Return to Health module. As we were designing the new SCHL, we listened to our clients. They asked us to provide more comprehensive symptom and condition treatment tools, putting the power of health consumerism into the hands of their members. StayWell's Return to Health is a clinically proven healthcare information and treatment guidance solution. It enables consumers to understand, identify, and act on the best treatment options for their condition, ultimately leading to improved outcomes and reduced clinical costs for your users. Return to Health covers 3,000 treatment options mapped to over 320 conditions. It guides your members through a process that encourages and enables them to understand and select the most clinically and cost-effective treatment for their condition. It encourages your members to focus on the most effective treatments based on clinical evidence and estimated time to recovery. You can include custom calls to action that encourage participation in your wellness and condition programs, and we support your care managed workflow. We do this to support your goals of reducing demand for ineffective treatments while maintaining member satisfaction. Here's a quick overview of how the Return to Health solution helps address the key questions that members ask when confronted with treatment options. Using evidence-based guidelines and resources, the Return to Health module helps your members answer these questions. The first question is, will it work for me? Return to Health incorporates StayWell's patient education to provide a consistent resource so that members understand their condition and treatment options. The second question is, can I afford it? Return to Health provides referential costs of relative treatment options. The third question is, what do others do? Through Return to Health, we present consumer feedback on how effective a treatment option was for them, bringing the power of health consumerism into health treatment guidelines. The fourth question is, how fast will I recover? To answer this question, Return to Health utilizes data on how quickly workers were ready to work again following a treatment episode. And finally, the question is, how do I proceed? What are my next steps? And this is where we help you build customized calls to action. You can drive people back to your programs, services, and staff, helping people accomplish their treatment goals. The Return to Health interface is user-friendly and clearly helps people evaluate their options and act on their next step. The guide recommendations are clearly categorized using your members' preferences and the Wiser Together treatment algorithm. Users quickly understand which treatments are best, good, and poor matches for their personalized treatment outcome. The ACT step contains your customized calls to action that drive people to your program to further develop your relationship with your members. And finally, I want to introduce you to our new Healthy Recipes tool. Good nutrition and healthy eating are at the heart of any healthy lifestyle, but we can all relate to how difficult it can be given how busy everyone is. It is especially challenging when a person needs to change their eating habits due to a health issue or new restriction. It's hard to know where to start and how to maintain the new habit. StayWell's partnership with Eating Well provides your members with a user-friendly resource for a healthier lifestyle. The Healthy Recipes provide members with over 1,500 recipes that meet their health, lifestyle, and eating preferences. The tool enables users to filter recipes based on personal, health, lifestyle, and culinary preferences, or perhaps a new dietary restriction. For example, users can filter based on a diabetes-friendly or low-sodium diet. There are also lifestyle recipes as well, so 30-minute dinners and, my favorite, kid-friendly options. The beautiful pictures contained in the recipes are both inspiring and help educate the user on ingredients and the dish they are preparing. Each recipe has been extensively tested to ensure that the directions are easy to follow and accurate. Your members can also have confidence in the accuracy of the nutrition analysis, helping to guide their eating choices. With these additional tools, the SCHL becomes a destination for your members, helping you engage, educate, and build relationships with them. Now I'm going to turn this back over to Mark to help you understand how the StayWell approach can help you reach your goals.
Thank you, Patricia. So now the big question. With virtually limitless marketing possibilities, how do we tie it all together? We use not only content pushes, but campaign strategies. The campaign approach organizes marketing efforts and provides message reinforcement with your members across all channels. Campaigns show a consistency that presents your organization as coordinated and efficient. Business silos might not be a term that's top of mind for members, but any customer who receives a print piece and a digital offering that don't carry the same brand voice will know something is up. Or perhaps worse, they won't recall that both messages came from the same place. Again, the research is clear that print still holds an important place in the marketing mix. Using campaign-driven print components is a key way of supporting your overall marketing effort. We offer off-the-shelf campaign-driven materials that can be customized with as little as the addition of your logo or with a full brand redo that includes fonts, colors, and other key graphic devices. Here we see a few examples of how we use humor and subtle irreverence to catch members' attention. We can develop a campaign from scratch to find just the right tone to engage your members. Campaigns can thread together all types of content in your marketing effort. They can make your web properties a destination. Use a key space on your site to offer recipes, videos, or an article from our consumer health library. You can also tie them to monthly health observances to give readers an expectation of pacing, or drive traffic with a periodic restatement of the campaign theme line, such as we see on the right of the screen. If you're wondering about what space on your site is best for such promotions, we can also do a UX audit of your site and make strategic recommendations for placement, design, as well as eye-catching devices to use. Everyone recognizes a play button. We can also design a similar familial icon to promote any digital property. Our research over the years shows consistent areas of general reader interest. Recipes always rank at the top, along with helpful tips on nutrition, weight, and sleep. Using social and outbound email to hit these key areas is a great way to drive traffic online and create a dialogue with your members. Here we see a few of our off-the-shelf campaign ideas. They're arranged to show a continuum of approach. On the left, we have the rational and logical. In the center, a simple metaphorical approach. And then on the right, we see a use of humor with a cautionary image about what could happen if you don't get enough sleep. Finally, digital marketing is uniquely participatory. With social media, your member is at the center. And here, quality of content is also uniquely important. We can guide you on the best way to leverage this media, from pacing to use of graphics, video, and infographics. Facebook posts with images get 5.5 times more likes, and with video and infographics even more than that. We can also advise you on best practices. The digital world is full of images that are pulled from databases by code and looked that way. We can make sure that your brand upholds its integrity in social and online. Now back to Victoria for some closing thoughts and Q&A.
Thanks, Mark. So let's take a step back and look at the big picture again and consider why these solutions could make a significant impact. The Trust for America's Health predicts that there is a return of $5.60 for every $1 spent on proven preventative care strategies in America. StayWell solutions, with examples we discussed today, can help empower members with the information they seek, improve outcomes with self-care and disease management skills, and reduce healthcare costs with wellness and preventative care education. We thank you for your time today and encourage you to ask questions. Again, you can do so via the chat feature on the lower left-hand part of your screen. We'll wait a moment for the first question. While we're waiting, I do want to let you know that there is a brief survey at the end of the webinar, and we look forward to your feedback. It looks like we have one question come up. How long does it take to produce a newsletter? Mark, would you like to answer that one?
Sure thing. Our typical time frame is 90 days, and that is from kickoff and ideation to the minute it arrives in home. Obviously, we develop custom schedules for every job, so in situations of a launch or any special situation where there's less time up front, we can always adapt to that.
Great, thank you. A second question came in. I think, Patricia, this one might be for you. It says, how often is the content updated in the Consumer Health Library?
Thanks, Victoria. Our consumer health information is updated on a regular basis. And so each day our editorial team is monitoring key publications to identify when health information is changing. As it changes, it goes through a regular review and update cycle. And as soon as that information is ready for publication, it's available to you through the Consumer Health Library. As a side note to that, all of our content is reviewed at least every 2 years. And so for those content areas that don't change that frequently, we still want to make sure that that information is up to date and accurate. And so our editorial team goes through each piece on a regular basis at least every 2 years.
Great, thank you. The next question looks like, how do we make sure another client in our region isn't using the same content? I think, Mark, that one might be best for you.
Yeah, thanks, Victoria. This one's a pleasure to answer. We have a proprietary software tool that tracks for overlap of all content assets, from copy to infographics to photography.
Awesome. The next question, what is the reading level of the Consumer Health Library content? Patricia?
Thanks, Victoria. Our reading level is typically at about a 4th to 6th grade level. However, we really follow the principles of plain language and user-centered design as we are creating our content. So we include other resources to help people, including videos, podcasts. We have image-only content for very low-level reading. And so we really cover the waterfront around literacy, meeting people, and helping to create the most engaging solution.
Great, thank you. It looks like the next one might be for you as well, Patricia. I'm going to read it. How long is the typical implementation, and can I host my own consumer health library?
Yes, from start to finish, the implementation of the Consumer Health Library is about 45 days. That enables us to meet with your team, make sure that all of the branding is accurate, that it really reflects your brand, and that those calls to action are driving people back to the experiences that you want them to have. And yes, you can host your own library. We have a fully enabled API solution, so we provide hosted or API-delivered content.
Thank you. The next question says, do I have to have all of these solutions, or can I pick and choose? Mark, would you be able to take that one?
Yes, sure thing. We absolutely offer a complete a la carte offering from these solutions. And we pride ourselves on being a from the ground up partner who can build just anything that is needed for a marketing effort.
Great, thank you. Well, everybody, thank you for your time today. If we didn't get to your question, please know we will follow up with you after the webinar. There is a brief survey that will pop up at the end of the webinar, and if you could take the time to provide your feedback, we would greatly appreciate it. Thank you.